like to have Dr. Moline come join us. Dr. Moline, again, is another clinician who is connected to Mount Sinai, now still in the New York area, and has added not only direct work with asbestos, but has become a leading researcher and commentator about the problem of talc.
Thanks. Thank you, Arthur. When I was first given this title, I looked at it and I sort of said, okay, I'll figure it out. And then actually, as I was thinking about preparing this talk, I actually thought I'd have a little fun with it. And I guess Linda, without knowing, recognized that my college major was the history and philosophy of science and medicine. So I'm going back to my roots. I'm not going to show you pictures of open lungs for the vegans out there. I'm sure you'll appreciate that. And I'm not going to talk about the way we can treat. What I am going to talk about is how do we get people to the treaters at the table here sooner. So what is occupational medicine? What is our goal? We want to identify exposures in situations that impact health. We define it by where the exposures happen. The exposures are the same. It's just the environment, well, or the area. I don't want to use the word environment. The place that the exposures occur. So if it's at the workplace, it's occupational. If it's at the home, it's considered environmental, and environmental can mean inside or outside. So what kinds of exposures and conditions do we see? We see pulmonary diseases, heavy metal, air quality issues. We do surveillance exams for known exposures, pesticide exposure, fitness for duty, work-related musculoskeletal disorders. So it's a whole spectrum of conditions. But what's the key element that binds all of this? It's an occupational history when we're dealing with people who had work-related exposures. It's vital to determine what causes the symptoms people are experiencing. How do we identify the jobs and exposures that will determine a diagnosis? How do you take a history? So all of you have gone to the doctor at some point, hopefully not very often, but when you've gone in, you're probably asked what you do for a living, and then they move on. That's not really taking an occupational history. If someone comes to you and has a potential work-related, exposure-related condition, you should be asked far more questions about how did it get to you. So you can start at the beginning, or you can start with what they do now, and it depends on the nature of the exposure. If someone comes to you with, and they just were exposed to something, you want to know exactly what they were doing, or if they have a new onset symptom and you want to know what has changed. If someone comes to you and they have a desk job, but they have a disease that may be related to an exposure, you need to find out what they've done throughout their career. So you need to find out what they actually do, not just what their job title is, and you want to know about prior exposures. Sometimes the way exposure history and data are collected can be erroneous. There was a case control study that was conducted in 1994. It looked at asbestos exposure patterns for mesothelioma. It was obtained through information from telephone interviews, in general from next of kin. So what's wrong with this method? How many of you in this room can tell me what your father did when you were a child or before you were born, not just what his job title is, but what he did? I can tell you my father was a biochemist, and until he was diagnosed with thyroid surgery, I did not realize that he held the world supply of californium in his hand. He never discussed the fact that he worked with radioactive materials as part of his early work as a postdoc. So I wouldn't have ever known that. If someone asked me, why did he get thyroid cancer? I'd be like, I don't know. So it just shows you, you're not necessarily going to get good information. And this study looked at occupational jobs where asbestos was thought to be likely. So they just looked at a few categories. They didn't think about the whole compendium of things, but they looked at breaker, boiler repair, shipyard work, or plumbing. They controlled for smoking. How many of you can give me your parents' smoking history? But they used that as a factor in this study. So they were looking for things for which people were not going to have good data. So not surprisingly, they didn't find an increased risk in women who presented with mesothelioma from their work history, from their histories, because they didn't know. Smoking doesn't cause mesothelioma, so it wasn't a confounder in this study. The family members or next of kin couldn't give an accurate account, and job exposure criteria were focused on occupations women weren't typically found in. This was a study that was looking at women, and most of the women didn't have exposures in the only way they asked if they had exposures. So if they didn't fit into one of these categories, they were said to be not exposed. So overall lower exposed category in these women led to a greater misclassification. And that's something that we see, and that's something that needs to be probed as people are coming in and presenting with mesothelioma or other diseases. Before I go into my cases, I'd just like to make very clear that these are not real people. These are cases I made up. These are based on 34 years of interviewing patients, but they are not real people. There are no names attached. The first is a 76-year-old lawyer who presents with a unilateral pleural effusion, fluid on one side, mesothelioma. He's a lawyer. We got a few lawyers in the room. He worked in an office-based environment, as most of them do, and he had no renovations in his home, didn't do break work, didn't do anything. So what else do we need to ask? We asked about his hobbies, we asked about his parents, and then we asked, what did you do when you were in college or high school? And he had worked in construction using joint compound and was around others using asbestos-containing products. Short-term exposure, 50 years earlier, or actually it was about, in this example, it was over 60, around 60 years earlier, led to the exposure that caused the mesothelioma. 67-year-old secretary is married to an accountant. Their parents worked in a grocery store, never did home renovations, no break work. They were diagnosed with right nodular pleural thickening and subsequently with mesothelioma. What's the exposure? The mother and grandmother of the patient were avid talcum powder users, and she used talcum powder starting from the age of 5 until she developed symptoms. Case study 3. A sheet metal worker responded to the World Trade Center. They worked on the pile for 22 days, arriving at September 11th at noon. When people arrived as a surrogate for exposure, people arriving on the first day had the highest exposure. Actually, people who were in the dust cloud had the highest exposure as they were there when the building collapsed. 2024, they developed shortness of breath and had unilateral pleural thickening with an effusion, and they were diagnosed with the mesothelioma. What was the exposure here? This one is multiple exposures. They worked as a sheet metal worker. Sheet metal workers are exposed to many people who are using asbestos-containing materials, or they were during the time era that he started working. They may have had some direct exposure depending on the ductwork they were working on, but most of it was working alongside insulators and others at that stage of the construction. We also know the World Trade Center had asbestos exposure from the dust, especially there in the early days. And we're aware of at least 23 people as of last year who had developed mesothelioma within the World Trade Center medical cohort, a program that I'm proud to be a part of. These cases are illustrative of the type of patients that my colleagues up here see all the time and are taking care of. And the common theme is that the exposures can be in many different environments. They can be at many different time periods. But if you don't ask, you're not going to have the answer to where it came from. So I hope this has helped you realize that you need to be comprehensive in looking. And it's really the fun part, in essence, is being a detective and probing and keep probing and look for various sources when one isn't apparent.